All right. So first of all, I want to thank our hostess for doing a couch conversation, and we're Insight to Teen Culture. Oops, give me 1 second. I'm going to share my screen and just tell you a little bit about Insight to Teen Culture. We are a group of professionals, and we all work with middle school and high schoolers and their parents. And our mission is to give, different programming, whether it be in person, which it used to be, or now online, giving teens and their families some support and ideas, solutions to the struggles that this is a challenging, being a middle schooler or a teenager is it's a challenging time. And then now being in quarantine just really makes it even more so. So we do these couch conversations for concerned parents, and our talk now today is on anxiety. My name is Stephanie Bean. I'm a therapist, and well, I'm many things. I'm a therapist, I'm a parenting instructor. I am the founder of Insight to Teen Culture, and my part on the anxiety is going to be the second part after Robin speaks, and my part is going to be on parenting and some tools for anxiety. So welcome, and I'm going to turn it over now to Robin. Robin, you're on mute.
Hold on, I gotta start all over again. Okay. Am I unmuted? Good. All right. Hi, I'm Dr. Robin Gingold, and I am a pediatrician at Agoura West Valley Pediatrics, and I've been in practice for almost 25 years. And I am also one of the founding member of Insight to Teen Culture. And so I'm going to start out by talking about anxiety from a medical perspective. And I'm sure all of you have met people who have anxiety disorder. It's the most common mental health disorder in kids and teens. And they say that something like up to 20% of kids and teens meet the diagnostic criteria at some point in their childhood or in their teenage years to be diagnosed as having generalized anxiety disorder. And at least half of those who meet the criteria will have some kind of impairment of daily functioning where the anxiety isn't just bothering them, but it affects how they actually can live and navigate through the world. So what is anxiety? It is excessive worry. And for kids, it's about school performance, about friends and social, about activities, excessive worry now about COVID-19, obviously, and things that are happening in the environment. And there's a bunch of different subgroups of anxiety. There is panic disorder, which is a really common one with teenagers. I see it all the time, especially teenage girls for some reason. When you're having panic disorders, panic attacks, you feel like you're having a heart attack. You just get this intense feeling of fear or discomfort. Some kids aren't even aware, they don't realize that they have this fear or discomfort. They just feel like their chest is beating hard. You tend to hyperventilate, so kids will be breathing like, they may not even be aware of it. And I've seen a child hyperventilate who didn't do it loud and you couldn't tell. I just could tell because I could see she was breathing fast and her hands and her arms started to feel numb. So it's just like a heart attack. Your shoulder, your arms feeling numb, your chest is tight, and it's a really unpleasant experience. And some panic attacks can actually result in fainting because if you continue to hyperventilate for long enough, your body says, oh, not getting enough oxygen, voluntary breathing is not working, our autonomic or involuntary system is going to take over and breathe for you, and so you pass out. It's not dangerous, but it is terrifying looking, and imagine someone who's already anxious then fainting. It doesn't do anything to help them. There's also social phobia. Some people are afraid to go out, be with other kids, be with other people. There is anxiety manifested as obsessive compulsive disorder, where you have to repeatedly do certain things to feel comfortable. And that one is very common in causing problems with being able to daily function. I've had lots of kids who can't leave the house to go to school. They have to wash their hands a certain amount of times. They have to tie their shoes a certain amount of times. Clothes have to be on a certain way. Or with going to any kind of large events, a lot of times kids have these obsessive compulsive disorders they have to do to be able to go out around a lot of people. And finally, there's post-traumatic stress disorder, where you have severe anxiety because of something that's happened in your life. And right now, something we all don't really realize, but many kids probably have post-traumatic stress disorder from COVID-19. It's changed their life, whether they're homeschooled or go to school daily. You know, they're not doing their daily functions. They're not out seeing friends, and social interaction is really important for teenagers especially, and kids too, for everyone, for all human beings. And so COVID-19 is really a source of post-traumatic stress disorder for a lot of people. So what are symptoms of anxiety? Besides just obviously feeling anxious, you can have chest pain. There's two different types. There's like a tightening of the chest, where a lot of kids will complain that their ribs are tight and it hurts, or a pain or a hollow feeling up the middle of their chest, which is acid reflux, because anxiety can cause gastritis, which is like a pre-ulcer condition, which can cause acid reflux. You can also have just being completely numb to the world, not seeming to care about anything, or avoiding feelings, not wanting to talk about things, trying to redirect to other people. A lot of kids who are anxious are just angry or irritable, and you try to talk to them and they just explode. And it's not really that they're angry or at you, but they're just so anxious they don't know how to express themselves. Very common, and almost like a sister to anxiety or brother, is depression. So depression and anxiety kind of come hand in hand, and a lot of people who have one will have the other too. A lot of people with anxiety, they lose trust in other people. They don't want to go on with the future. They act out. For teenagers, a lot, drugs and alcohol, academic grades going down could be a sign of something that has to do with something anxiety related or depression related. Refusing to go places. I had a patient early in COVID who, at first, she was going for walks with her family. They couldn't go out much, but the things that the family did, play games, she would do it with them. And then all of a sudden, the mom called and said she wouldn't get out of bed. She wouldn't go for walks. She wouldn't get dressed. She wouldn't take a shower. And all those things can be depression, and they can also be, and for her, it was just an extreme anxiety about her future and what was going to happen and where she was going to go. You can also have, like butterflies or heart palpitations. You can have insomnia, where you can't sleep. Stomach aches, very common symptom of anxiety is stomach aches. I would say that at least of the third of the kids who come into me with stomach aches, it's something anxiety related and not actually physical or mentally. So what do I as a doctor do? Well, first I want to rule out anything medically. So I need to make sure sometimes things like your thyroid, if you have a hyperactive thyroid or hyperthyroidism, you can feel like you have anxiety disorder. If you have low sugar, you can feel jittery. Chest pain could be from asthma. Kids really don't get heart attacks unless they have an underlying heart congenital malformation, something they're born with. It's not going to be a heart attack, but it could be a congenital thing. It could also be medicines. I can tell you, anyone who's ever taken Sudafed and coffee together, which I've done, I thought I was having a heart attack. My heart just popped right out of my chest. So certain stimulant medications, ADD medicines, asthma medicines, some kids might say they can't take their inhalers because it makes them feel too jittery. So those are all things that you have to rule out. And then also drug and alcohol. Either use or withdrawal. So kids who decide, hey, they've been, surreptitiously drinking and they're not going to anymore, or they're smoking marijuana and they're not going to anymore, they can become really anxious and jittery and angry, and you think that it's something psychological, but it's actually a physical withdrawal. Differential diagnosis besides medical things, sometimes kids who have learning disorders look like they're anxious, but really it's just they've got learning disorders. And as I said, depression, and sometimes kids are anxious just because they're really grieving, and it's not really, it's like a, you know, something could have happened, a breakup with a friend, cyberbullying, parents divorcing, parents moving, things like that. And so what do we do? What do I do, I should say, for treating anxiety? Well, first thing I do is assess how much the anxiety is affecting the child or teen's function. If it's affecting them to the point where they can't do what they normally want to do, that's the child who needs to seek therapy. And I encourage those kids and their families to go see therapists. Some will, some won't. But there are a lot of basic things you can do to ease anxiety. One of the biggest things is getting out in nature. It's basically having healthy habits. Get out in nature every day for at least an hour. And even in this time with COVID, I tell kids, you got to go outside, put a mask on, go for a walk, go for a run. Physical activity is really good to ease anxiety. But it doesn't have to be running a marathon. It could just be walking with your family, or walking your dog, or anything, or sitting outside and walking around your backyard. Sleep is critical for maintaining sense of well-being, and most teenagers need anywhere from 8 to 10 hours of sleep, and most teenagers get anywhere from 6 to 7. And it's really been a problem with this COVID that a lot of kids are staying up really, really late and getting up really late. And that affects mood too, because you need sunlight. You need to get up and see the sun to have a sense of mental well-being. So it's important to have a routine. Get up in the morning, make your bed, feel like you have a structure and a purpose in your life. Otherwise, that can actually create a lot of anxiety if all structure and all routine is gone. For exercise, things like yoga and meditation are great to help relieve anxiety. For kids who won't do that, even they have apps on the phone for deep breathing that you can do. Then with counseling, I've had kids who are really resistant. They won't want to see a therapist. So then I'll say, well, do you have someone in your family you feel comfortable talking to? Maybe not your parents, someone, an aunt or uncle, or if they're part of a youth group, or you know, a counseling group of peers, sometimes they like better. Then finally, there are psychological treatments that I'm going to let the specialists get into, but things like cognitive behavioral therapy and coping strategies for social interactions that you can do too. And so that's basically what anxiety is.
Thank you so much, Robin.
You're welcome.
And so now I'm Stephanie Bean. We have somebody else who just joined. So I am a therapist, a parenting instructor, and I'm going to be speaking on that perspective. I have a PowerPoint presentation that I am going to share so that you can see what I'm talking about as well. So some things that come along with anxiety are feelings of insecurity, low self-esteem, a lack of structure. During this time, I'm seeing so many teens, really all age kids, really having a lot of anxiety because of this lack of structure that Robin spoke about as well. Feelings of chaos, more fighting, which I believe Robin said as well, and from pressures. So right now, I think there are a lot of pressures for adults and for kids. And that's another very important thing to mention, is that sometimes we as the parent, we might have anxiety. And what happens is our kids then can pick up on that anxiety. So what can we do as parents? What can I do? So here is some ways to help when your child is exhibiting some kinds of anxiety or stress. And these are the things that the parent can do. And it's a fine balance, I just want to mention. sometimes parents have a tendency, I'm a parent as well, of a 18 and 23-year-old. And so, we don't want our kids to feel bad. We don't want them to be suffering. We hate to see them anxious or, struggle in some way, whatever that is. And so we want to help. So these are ways that you can help, but not take over the problem. Because as a therapist, I see often that the parents sometimes will take over and fix the problem for the kids. But what happens is the children then don't have that satisfaction, and they don't have the empowerment. Like, wow, I know how to do this skill. So we will come back to that. So these are the ways to help. Attend. So eye contact, silence, of course, saying nothing, which we'll get back to. There's a reason why silence is on this list. Acknowledgements. So just saying, like letting them know that you hear them. Door openers. That's like, oh, tell me more, or I'd like to hear more about that. Active listening. This is a thing as a therapist and as a parenting instructor that I use, and I'm sure you've heard this term before. It's a way of repeating back what you hear your child saying in your own words. And I like to use a feeling word with it. So active listening is you hear the facts and feelings, and then you repeat back what you hear using the feeling word and expressing your own empathy and acceptance for your child. So I'll give you an example. A lot of times kids won't. Actually, I'm going to stop sharing for a minute so that I can see you. Sometimes kids, won't come directly out and say, I have a problem. They may go in their bedroom and not come out, right? And you think, that's not the normal behavior of my child. So an active listening response might be, to knock on the door and to go in. It seems that you've been staying in your room a lot, and I'm wondering if there's some feelings of, wanting to be alone. And just to open up the conversation. So allow your child then to tell you what they're feeling. Now, I am going to share the screen again because I want to show you the things not to say. And these are what I call, well, they're called the 12 roadblocks, but these are what I call the parent things to say. So this is what we're used to saying. So we might, at different degrees, and we all have our favorites too, by the way. We don't use all of them necessarily. But if you look at the list, you might be able to pick out some of the ones that you do. So ordering is one. That would be like, you need to go, pick up your towels from the bathroom. Warning, if you don't pick up the towels, this is what's going to happen. Moralizing. So that would be like, all good kids pick up after themselves. Advising, and this is probably one of the most common ones, is like giving them some ideas. Now, I'm not saying that not to give your kids ideas. It's just a matter of how to approach that. So we will talk about how to approach that because there's going to be something called the 6-step process that I'm going to teach you at the end. So we have arguing, judging, praising. People always ask me, why is praising bad? It's not to say praising is bad. All it's saying is when your child is struggling, when they're having a problem, this isn't the time to say, like your child saying, I just can't come up with an idea of what to write about. And you say, oh, I'm sure you'll come up with something. You're so good at that. You're so good at ideas. Well, that's not really hearing what the child is saying, right? The child might not feel heard. So what you might say, an active listening response would be saying something like, you're really struggling. You don't know what to write about. All right? And it's so hard because you want to say more. Saying less really is best. We have good name calling, analyzing, reassuring. Now again, reassuring in the no problem area when there's nothing going on, that's okay. But when there's a problem, the child doesn't feel heard or understood. If you're reassuring and inside they're not feeling, they don't feel like they can do it. People want to hear a connection of kids and adults of, yeah, I can hear you're really struggling, not you're going to be fine, because it doesn't feel true at that moment for your child or for yourself. Probing, that's asking a lot of questions, and the implication to that is, tell me how you're feeling and what happened and why did you do that and what did the other person say, is implying that you'll tell me everything and I'll fix it for you. So what we want to do is empower our children to come up with their own solutions. So I want to go back to active listening and just show you this diagram, and then we'll talk about, after doing the helping skills, attending. Silence, by the way, that was in replacement of the roadblocks. So when I want to say a roadblock, and here I've been teaching this for 25 years, and I still find myself occasionally using one of those roadblocks. So silence really comes in handy. So we have attending, silence, acknowledgements, door openers, and active listening. And here's a diagram about active listening. So active listening is the child might say, will the test be hard? And then you as the parent, where it says number 1, decode, you're going to decode, what is my child possibly feeling? Because we don't know for sure, but what's a possibility? So I might say, it could be worried. I'm going to check it out. So I might say, you're pretty worried about passing that test. And the child then is going to think to themselves, worried. Is that what I'm feeling? And then they'll let you know, yes or no. And then they'll tell you more. No, I was just asking because, and then they'll tell you more, and you can go with that and active listen that. But, we all want to be there for our kids. So this is a great tool to let your child know that you're there for them and that you're trying to understand. So the goal is not like being perfect or understanding exactly. It's about being there and listening and wanting to hear. So again, like I said, we don't have to be, we're just guessing here in the worried spot. Is it worried? We're just guessing, and that's okay, because the child will tell you yes or no. All right. So then the last thing that I'm going to talk about, which is very helpful for anxiety and for any kind of problem that kids are facing, is this process. It's called the 6 steps of problem solving. And it's a way to guide your child to solve their own problem. So we talked about, I had mentioned, I did, not to take over the problem, but here's a way of guiding. So in my office, I teach all my kids, young and old, and adults, this process because it gives them some structure. So the first step is define the problem in terms of need. So what is the person needing? So a child may say, especially during this time, oh my gosh, I'm going crazy. I just want to get out and see my friends, right? So what is the need? The underlying need to that is social, potentially, I mean, again, this is, we need to do some active listening to find out what the exact need is. But I'm going to say for now that it's social. A lot of my kids in my private practice are talking about this, really like struggling with wanting to, not being able to see friends. So then the next step is, well, how can we, let's brainstorm some ideas, some solutions. How, what are some ideas? And I literally, that's why I have this pad of paper always by me at my desk, is I will write them down. And I do this as a parent and as a professional, I will write down some ideas. So what's an idea for socialization? What are some ideas? Well, one is FaceTime with a friend. I always, by the way, let the child come up with the first thing, if possible, and I wait, because sometimes, it takes them a while to think like, okay, what, I don't know. I mean, they wouldn't be feeling anxious or struggle if they knew an idea, right? So I might wait, like, okay. Or what I also do is I may throw out something like totally crazy, just to get the ball rolling. So I might say something like, well, yeah, you can go outside and see your friends. That's one idea, and I'll write it down. Like, we know that that's not possible, and we will have time in the evaluate solutions to cross things out, but I write everything down. So FaceTime, go out, have a dance party through Zoom. Go to, I believe now the parks are open, go to a park and be at a distance and see your friends. And the kids, I'll tell you, especially like one of my daughters, she is amazing at coming up with solutions. So the kids will come up with solutions that we never would think of, especially if they have a little bit of time to think about it. So I wait and I say, gosh, right now we only have 3 ideas. I really like to have at least 5. So we have some choices here. So I'll kind of encourage, well, what else? What else can we do? So then we go through the list. So step 3 is evaluate solutions. Now, so FaceTime is one idea, and the child may go, no, I hate FaceTiming. Kids don't really care for that. So we'll cross that out. Go out. Well, I would say at this point, yeah, I wish that was the case. I'm missing my friends too, but we have to cross that out because that's not really a possibility. Have a dance party. Oh, that's stupid. I don't know. But then they may say something like, one thing that I found is what is it called? House Party. It's an app where you can play games, and my family does this. We play games through House Party on the phone, and that's more kid friendly. And so maybe they would pick that one. Yeah, I could try that. I've never seen House Party before. And so then so the other ones were crossed out here. So the choosing solution was just the last one that the child accepted. But what I normally do is I go through, and sometimes the kids will say, yeah, maybe. Okay, we'll leave that one. No, not that one. So usually we have 2 left over. And then I say, okay, so which one would you like to choose? Number 4. And the child might say, okay, you know what? I actually like the dance party idea. I want to try that. Okay. So we implement the solution. And then, so we allow our child to implement the solution. And number 6, though, is really important, and that is to go back and check the results. So to come back and say, hey, did that help your problem? Because if not, let's start again at number 1. And maybe it's not social, maybe it's something else that you're needing. Now, the reason why we do this is because we also use this skill when it's both people's problem. So this is when your child has a problem, but we can use the 6 steps when you have a conflict. I'm trying to think of one. A conflict like, oh, well, I'll give you an example in my house. So my 23-year-old daughter is back from school and she's living at home after being gone for 4 years. And so she's working from home and my office is right below her room. And she likes to dance. And so she is dancing, and that I can hear everything. I can hear the music. I hear steps on the ceiling. And then she complained because she can hear what I was saying. So we did this process. So we both have a problem, right? I need to work and she wants to continue to dance. So how can we both get our needs met? So we brainstormed some solutions. And when we went through the entire thing, what we came up with was to put my office chair, I have a desk in my bedroom, but she brought my office chair upstairs for me. And now I have a makeshift office and her bedroom is over there. I don't hear a thing. She doesn't hear me. And so we came up with a solution that we were both happy with. So I am happy to answer questions about this, but I'm going to stop the recording and